and welcome to the Health and Adult Social Care Overview and Scrutiny Committee. I will start with apologies. We have apologies from Councillor Lammas, Councillor Thorne and Councillor Elizabeth Turpin. Can I sign the record of the meeting held on the 11th of October as correct? Can someone say agreed? Right, thank you. There are no urgent matters to announce. Are there any disclosable pecuniary interests or other significant interest or any declarations of whipping? Yes.
Just to say that I'm a public governor of the NHS Foundation Trust.
Thank you. Before we move on, can I ask that those introducing reports should assume that members have read the papers and aim to keep the reports and introductions reasonably short, no longer than 5 minutes, or as I said earlier. That takes us on to the agenda item 5, the Community Diagnostic Centre. Nikki Teasdale, the Director of Delivery, Medway and Swell Health and Care Partnership, was due to attend tonight for this item, but unfortunately is not able to be here. David Whiting will introduce her report on Nikki's behalf. After Michael Turner will briefly introduce a covering report on the issue of whether this proposal is a substantial variation. I will then say a few words and then ask David to introduce the report. So, over to Michael.
Okay, thank you, Chairman. So members tonight have been asked to decide whether these proposals constitute a substantial variation or development of a health service. And there's no formal definition of what constitutes a substantial variation, so it's down to members to make that decision. If you decide the proposed changes aren't substantial, that wouldn't prevent you from reviewing the proposals and making reports and recommendations. If you decide that the proposed changes are substantial, then the NHS must consult with you prior to a final decision being made. In that scenario, the committee would need to decide whether or not it supported the final decision and would be able to make comments and recommendations. And as members will be aware, is a last resort, really. There's the possibility of referring decisions to the Secretary of State in certain circumstances. Just finally, in the report at paragraph 2.9 mentions that Kent's Health Scrutiny Committee was due to consider these proposals as well. Now, the Kent's Health Scrutiny Committee met yesterday and decided that the proposals did not constitute a substantial variation.
Thank you. I agree with the Kent's Overview and Scrutiny's decision, and I would like to just briefly say my personal reasons. In my view, this proposal does not constitute a substantial variation for the following reasons. Increased diagnostic provision in the community will improve our access, particularly for communities facing the highest level of health inequalities. The Equality and Health Inequalities Impact Assessment shows no groups will be disadvantaged or adversely impacted. The CDCs will mean diagnostic services are closer to people's homes, allowing for more timely and local access. All things I think this committee has asked for on different issues in the past. So with that, I will go to David Whiting.
Right, thank you. Okay, the development of the Community Diagnostic Centre hub and swoop model within Medway and Swell will provide an opportunity to redesign clinical pathways that require a range of diagnostic services. The key objective is to increase the total amount of diagnostic service provision that is available to meet the needs of the local population, ensuring more equitable access to diagnostic services and a reduction in travel times. Medway and Swale has some of the highest levels of deprivation, as you've just heard, and with some wards being in the 20% most deprived areas of the country. Diagnostic capacity, and that's both equipment and staff, is one of the greatest barriers to recovering to the elective backlog recovery, which inevitably leads to poorer patient outcomes due to a lack of timely access to tests. A considerable amount of work has been undertaken to develop and refine the model for Medway and Swale Community Diagnostic Centre to define the plan, with a focus being on reducing health inequalities. Public health information has been used to identify 2 sites where we will effectively offer equitable provision to our population, to the parts of the population that are most in need. The main hub will be sited at Sheppey Community Hospital with a spoke at Rochester Healthy Living Centre. Both sites will offer a wide range of diagnostic services and significantly improve accessibility for our communities. The CDC will support and align to the delivery of rapid diagnostic services and will play an important part in the wider strategy to deliver faster and earlier diagnosis and improve patient experience and outcomes. It will bring together the latest diagnostic equipment and expertise. It will also complement the work to improve cancer screening programs, to improve early diagnosis and improve clinical outcomes. The CDC is part of a national program to support recovery after the pandemic and ensure sustainability of services. Services will not be reduced at Medway Hospital as a result of the CDC, but the CDC will offer additional capacity in all diagnostic modalities. The services going into the CDC in Rochester Healthy Living Centre are already provided, with a mobile scanning provision offered on a rotational basis. The CDC will provide an increase in the modalities already offered and allow patients to access these services closer to home. The building work is using a void space within the existing structure to make it fit for purpose for future demand. A couple of issues have been flagged, one around workforce and staffing capacity, and initiatives have already been in place to improve recruitment, and recently there's already been some success in this. Additionally, Rochester Healthy Living Centre has been identified as being the most feasible option for a spoke site due to its central location and public access routes. We are aware of some issues around parking, and that is being addressed. There are plans underway to address that. The mobilisation plans will include exploring the wider infrastructure land owned by Property Services that is currently not utilised, and that will help with the parking issues. I'll end the introduction to the paper there. And I must say that while I've been involved in some of the work on this, I'm not familiar with all of the detail. So if I'm not able to answer questions, I'm happy to take them down for Nikki to reply to later.
Right. Thank you, David. Councillor Murray.
Thank you, and thank you for the report. I'm sorry that Nikki isn't here, actually, because I think that would have been helpful, and it might have been helpful to have somebody here from the hospital as well. That said, the Labour group agree with you, Chairman, that this is not a substantial variation. And our reasons are that we don't want to hold back the development of this centre because it's been really a long time coming. And I hope it will do some of the things that the report tells us it will do. Having said that, it's in my ward. The spoke centre is in my ward. And I think there are going to be some logistical problems. So through you, Chair, I think I would like to ask, I don't mind who comes along, but I would certainly like to have a location meeting to discuss some of these things. We've long had the mobile breast cancer screening unit at the Delph's Healthy Living Centre, and indeed it was there throughout the pandemic, and people managed quite well, because obviously it does always take up parking spaces, but parking is very tight. There isn't any There was very little on-street parking in that area. There is an additional car park that seems to me to be underutilised that I believe is owned by the Healthy Living Centre. And I hope that that's going to be able to be brought into use. But I think it would be helpful to have a location meeting, because I understand that pathology is going to be one of the services available through the CDC over time. And of course, at the moment, there is drop-in pathology at the Rochester Healthy Living Centre that serves a very wide area indeed. And I think it's correct to say that the Thorndike practice have still got the contract for the pathology service. And that service has had its problems over the years. So if that would be possible, then notwithstanding other questions and comments, I hope that people will welcome this. I think that's only fair on all of the services already at the Healthy Living Centre. The paper does tell us that there's going to be engagement, and maybe what I'm talking about is already covered, but certainly nobody has attempted to contact me or my colleague Lauren Edwards about this. And it is an area where there's also been some recent additional development for older people, directly adjacent to the health centre. So there's been a big increase, actually, in the number of flats there and in the number of cars that people have locally. Directly behind the health centre, there's an area of extremely high deprivation, which has got actually other problems with antisocial behaviour. So I can see that a joint service meeting, perhaps involving the police as well, might be helpful to ensure a smooth transition. So that's my first set of comments, and I'll be looking forward to the answer. The other thing is that in paragraph 1.14, it says that all the additional capacity via rented and staff mobile scanning facilities will be delivered at the Sheppey site. So that already means that people in Medway who might have been going to the hospital, because although you've said there's no reduction at the hospital, it does say that space is going to be freed up. So there's going to be a period of time, or that's my reading of this, where people in Medway will have farther to travel. And actually, if you haven't got a car, travelling to Sheppey isn't at all easy. It's in fact very difficult, both by train and bus. So I wonder what we're going to do about that.
Please, David, if you can answer or pass those questions on.
Okay, thank you. Yes, I can answer one or two of them, I think, and then I'll have to pass the rest on. So with regard to parking and that additional space, that is part of the plan, and that will be, I think, made dedicated for staff, so that then the other area will be, there'll be more spaces available for patients and members of the public. With regard to the capacity and access for Medway residents, my understanding is that by providing extra capacity over in Sheppey, that means fewer patients would need, from that side, would need to go to Medway Hospital, therefore increasing capacity available at Medway Hospital. So that should increase capacity for Medway residents locally. And regarding the meeting, I will pass it on to Nikki. I'm quite sure that she'd be quite happy to do that, but I'll pass it on to her.
Just for clarity, would you be happy with a Teams meeting, or would you prefer on site? Or
I think that if possible, it would be helpful to meet at the health centre.
Yep,
and as I say, to involve the local police, because that car park is a troublesome area. And at the very least, I think there will need to be some increased security for the staff there. And the building itself has got some parts to it which there's easy concealment of antisocial behaviour activity, particularly around the back of that building, that over the years I've had various dealings with, and I think, you know, I would want to be sure that everybody was safe, and actually the improvements might particularly help the people in that new development who have suffered trespass from people who can get into particularly their outside areas, by using the areas I've just spoken about in the health centres. So if there's something new that's going to go there and there's going to be more people there, then to me it's an optimum time to have a look at all those things.
Okay. Thank you. If you pass that on, preferably on site. Thank you, David. Sorry, Councillor Purdy.
Thank you, David. I just wanted to say I agree with Councillor Murray. I think parking is... I went to have my booster jab there thinking, oh, it's going to be wonderful, I could park easily, but you couldn't. It was absolutely chock-a-block. The staff were very helpful and very obliging, but they don't want to be running around helping people with parking all the time, do they? So I absolutely agree. I think that to have a site meeting there would get us more understanding of how the layout will be, because I think it is an advantage. I think this is something positive for Medway, and I also think by having it at Sheerness, it certainly will be more positive for people in Sittingbourne, and as you say, take the pressure off of Medway. So no, I'm very much for it, and I certainly don't think it's a substantial variation.
Thank you. Oh, sorry.
Going back to, thank you, Chairman. Going back to the parking, the car park is terrible, but there is that one, as Teresa said, just round the corner really, and I pass it quite often, and there's normally 1 or 2 cars in there. So if they could make that into the car park for it, it would be really good, because people. It has a barrier, whatever, but there's only 1 or 2 cars. So please, if we could look into that, that would be a really good idea. Thank you.
Thank you.
I'll just come back quickly. I mean, thank you for your support, everybody. That car park, I think, will need something like automatic number plate recognition if it's going to be used, because there's loads of problems with a garage operation down there that start working in there periodically and all of that kind of thing. So it really, it will have to be completely refreshed in order to be secure if it's going to be used.
Thank you. There are no other members. Can I also, by the tone of the meeting, we would like regular updates on this. So in the recommendations, I think, well, over to Councillor Purdy, but if you could add regular updates, please.
Thank you, Chair. Yes, I think that we are in agreement that this proposal is not a substantial variation and that we welcome it in Medway. We would also, but we will like more information on it and regular updates, as Councillor Wildey has said. And we would like a site meeting there more than anything, I think, David. Thank you.
So, full agreement and sort of seconding that. It was useful to have this information, actually, the health information presented in the way that it's been presented, because I think it encapsulates a lot of the worries that we've got about health inequality, and I found it a useful way of looking at it, actually.
Thank you for those comments. Sorry, is that agreed?
Agreed.
Right, thank you, members. That takes us on to agenda item 6, Kent and Medway Adult Learning, Disability and Autism Collaborative Update. James Harmon will introduce his report, but we also have Marie Hackwell to help. Thank you. And sorry, I do struggle with names. I'm dyslexic. It's one thing I always trip over, so I'm sorry.
Thanks, Chair. I'll give a brief run through of the paper and then I'll introduce Marie formally, and then she can answer any questions we have. Jackie's obviously here. We've all been in a strategic meeting this afternoon around this particular agenda, so it's at the front of our minds at the moment. So hopefully we'll be able to answer any questions. So you're probably a little bit sick of the sight of me coming on this agenda. I think this is the third time in 12 months that I've been here, so it's good that everybody's so engaged in it. So the paper just gives an update of the last few months' work that's been happening. The main areas of the report that I'd like to point you towards are the developments of the particular work streams. So we've got work streams around the development of a strategy, around the delivery of services, around co-production engagement, which was highlighted at one of these previous forums as being really important about getting service users with lived experience involved in the work that we do. Quality assurance, so how do we know what's good? And again, I think that was something that came up at a previous meeting around, how we actually judging whether these services are of good quality in delivering the services that we need. There's one on health improvement, as you would expect from people in public health, and probably most importantly, the one that I chair, which is the workforce subgroup. So we've got that. There's been a development of a multi-agency programme delivery unit. So that is effectively a sort of matrix unit where you've got people from all of the different agencies involved. So the ICB, Medway Council, KCC, KCHFT, all working in that matrix management. So working as if we're one team, but obviously we're employed by the separate organisations. Representation, again, was something that came up in previous meetings about Medway having its voice. I think it's fair to say that we are attending all of the meetings. Today we had really good representation from Medway at that strategic board, and I think we have representations at I think all of the groups and the subgroups that we've got. So we're definitely there making sure that our views and the views of our residents are heard. So I won't go over it too much because I know you might have some questions that Jackie, Maria or I might be able to answer.
Thank you, and thank you for the report. I think it's really important that we've seen you, quite a lot, James, because this group of people were very poorly served. I wanted to ask you about 3.14, about the stakeholders meeting that's planned, whether there isn't actually, if there is actually a date set for that in early December, and in fact whether, if we wanted to, we could come along. That's my first question. I noticed today that the annual Ombudsman complaints report is out, and a very high percentage of people from local authorities are people who have complained of people with autism, who have not been able to be seen in a timely way. And with that in mind, looking at 3.31 and 3.32, that seemed to me a very low percentage for health checks, 18% of patients on the learning disability register, and that's above the national target for the end of quarter two. It seems to me that the national target might be a bit low, if that's the situation, but I, stand to be corrected or reassured by anybody.
Yeah. Good evening, everyone. I'll introduce myself just so you know who I am. I'm Marie Hackshaw, and I'm the System Programme Lead for Learning Disability and Autism across Kent and Medway. So that is a temporary post. I'm in the post till August next year, and it's a jointly funded post on behalf of Medway Council, Kent County Council, and the Integrated Commissioning Board, which is really great, actually. It's been lovely because I've sat in this space for some time in terms of working with people with learning disability and autistic people, and it's really nice to be able to represent all three elements. So thank you for your questions. In relation to the stakeholder engagement, we had planned it for next week, which was on the 8th. However, having spoken to people with lived experience and to colleagues, we realised that given the current crisis in terms of cost of living, that actually to ask people to come to a venue, one place in Kent or in Medway, would be actually quite difficult for people to attend. So what we've done is to flip it on its head, and we're going to go out to meet with people and go through the groups that we know are locally around. But we would very much welcome conversations with everyone, so we'd be more than happy to come and meet with you directly as well, or that you could contribute in some way. That would be really helpful. So we have got some plans to start that engagement piece of work over the course of the next few weeks and into January, with the view of informing our work plan for next year through a real co-production piece of work so that people with lived experience will inform that and drive that through the strategy that they've developed across Kent and Medway as well. Does that answer your question particularly?
If you come to the second question, I'll come back.
Okay. In terms of annual health checks, the target nationally in terms of completion of annual health checks is 75%. So 75% of people with a learning disability on the learning disability register should have an annual health check each year. The ideal is that 100% of people on that register would be offered an annual health check, but 75% is the national target. And it's weighted so that most of those health checks fall in quarter 3 and 4 of the year, because that's when it tends to happen. We're trying to shift that pattern in Kent and Medway and to move to having a more regular distribution across the year. So we're working with colleagues to implement something called annual health check birthday card, which will be an invite to people around the time of their birthday to come to meet with their GP to have an annual health check. And we feel that will work better and spread it out across the year for people. In terms of statistics, I have got the October data from Medway itself. And for young people between 14 and 17 years, 18.8% have had an annual health check to date for this year. And for adults over 18, 26.5% of those on the register have had a check. So we're making good progress, but we still have quite a bit of work to do to make sure we reach the target for this year.
And if I may just add to that, we can follow up with the full figures, but the trajectory for Kent and Medway for LD health checks in the last 3 years has gone up exponentially. It was a real issue that was picked up at senior level sort of 2 or 3 years ago, but the trajectory is much, much better for that. And I can't remember what last year's final figures were, but it was over double the previous years. So we would expect to work on that again, but I can circulate that to members afterwards so you can see that trajectory.
Thank you. Councillor Murray, did you want to come back?
Yes, please. Thank you. If I can just come back. So that's reassuring to hear. But I suppose my concern is it's good to see all the work streams, and it's really nice to see that the strategy is progressing. But this report doesn't tell us very much about the position of people now who are kind of, victims might be too strong a word, but they're certainly subject to the building of this strategy and this service, aren't they? And they are still somewhere in the system, many of them, either waiting to be seen or waiting to get services. So I wonder if you could tell us a little bit about how, as the strategy is being developed, the people who are already there and are hoping to benefit by this in its entirety when it's complete are being treated now. You know, has it added to waiting times? Has it changed waiting times? Has it made anything better or worse as far as you're concerned? And one of the reasons I ask you, is because when we've seen transition to new providers for services before, I can think about the eating disorder service, for example. It's clear that in the transition, people fall through the gap.
So just so I'm clear, I think you're asking about diagnostic.
Adam's being very kind, is it?
I think you're asking about the diagnostic pathway, is that correct? Sorry, just so I'm clear. Yeah, okay. So in terms of the change of service provision, from April this year, Kent Community Health took on the contract for diagnostic services for adults, autistic adults, or adults who are exploring a diagnosis of autism and ADHD. That has improved the position. So at the moment, there has been probably about a 6-month wait for people to access an assessment for autism while that transition took place. But that will improve over the next few months to work to having a 12-week wait, which is the national target in terms of that clinical pathway. So I would say, yes, that has improved. The access for those who are looking for an attention deficit hyperactivity disorder, ADHD, diagnostic assessment is more challenged because the demand for that assessment has has considerably increased beyond what our anticipated demand would be. So the service was commissioned on the basis of the previous demand, but in the last 12 months, that has increased substantially across the country. That's not just particular to Kent and Medway, that's a national challenge that has occurred. And we're trying to find ways to address that to keep the wait times down as low as we possibly can based on that numbers coming through.
Last question, Chair. Do you know why there's been that increase? It seems to me to be a strange thing to have increased post-pandemic. I'm not, it doesn't match lots of other things.
So our understanding from what we can see nationally is to do with a heightened awareness of neurodiversity. There's been quite a lot socially and in the media around ADHD in particular. A lot of people who are public figures have talked about having that particular neurodiversity, and therefore we think that it's been driven a little bit by that particular situation.
Thank you.
Thank you, Chair. You've answered it in a slight way with transition. That is a big concern for me, and I was at some training on Tuesday, and of course we were talking about autism, but often many of the people who suffer from autism are very bright people who can contribute to society and want to, but we seem to sort of get half stage, and they're okay when they're at school and we're giving them that, and then they leave school and then there's that gap. And that concerns me. And as I say, reading these papers, I couldn't see, I assume that you're doing something about it and you will be supporting people, but I don't see anything in the paper about it as I was reading it. So perhaps if you could help my curiosity.
So yes, that absolutely is a gap, and one that we, as commissioners across Kent and Medway, recognise. We're working with people with lived experience, so we've got a group called the Transforming Neurodiversity Board, which has representation from across Kent and Medway of people, autistic people, and they are helping us think about how we might inform and develop our plans around that. But we're particularly focused on opportunities in terms of jobs. That's really quite important because as you say, many of those individuals don't have jobs when they could do, so looking at supported employment and opportunities for people to be employed. And particularly looking to organisations within our collaborative to lead by example and employ people who are autistic and who have learning disabilities as well. So that's one of the key drivers that we're focused on at the moment. And then thinking about opportunities in terms of community-based support and housing, because that's the other bit that often can be challenging in terms of enabling people to live well and to engage in society through jobs and opportunities that are available.
Come back, Jay. Yeah, that's great, and also educating the public and employers, because once you say, they're autistic, they're autistic. Well, they're not. They're very bright and people, or at least most of them that I've met, are extremely bright and make me feel very stupid in some of the things that I say. So no, I think that's brilliant if we can. Yeah, and it's important that we do. Okay, thank you.
Sorry, Jackie, did you want to come in there?
Thank you, Councillor Purdy. I just thought I'd give you some assurance about some work that's started in adult social care. So we've introduced a scheme for people with ill mental health and about enabling them to get into work. We got funding from the DWP to do that. We've also just got funding from the DWP to do the learning disability and autism. So we're to get people into work. We've been successful with a couple of people with mental health, so we're following the same approach, working with Dan Radcliffe in skills and that wider collaborative. So just wanted to let you know that work has started. And you're absolutely right about leading by example. So I've given that proposal to my team that when they are recruiting, that they need to think about making roles accessible.
Did you want to come in, James? Or?
Yeah, just very briefly. A lot of the working groups that we've talked about have got service users with lived experience, and just this afternoon we had two of those users who were regularly pulling us up on the use of language and about understanding how they work. So I think as professionals, we're learning along the way around not using jargon and around explaining it, the use of visual aids as well as just talking over it. So all of those things we're learning, we're passing that learning on. So anybody that is embedding that will do that more. We've also got a training scheme with BMIX, which I think I mentioned in a previous meeting, which they train users with lived experience to get the skills to be able to take part in those meetings. So obviously it can be quite daunting to come into the forums and, you know, be surrounded by people that, you know, might be using jargon or are those professionals. So we're actively seeking Medway participants for that, so they can come on some of those groups and participate with confidence and knowledge.
Thank you. Councillor Price, thanks for your patience.
Thank you, Chair. Yes, I wanted to ask a couple of questions. I mean, it's great that there has been a Kent and Medway learning disability and autism strategy which has been developed. I wanted to ask about the experts who I understand are meant to be representative of the various groups concerned about how they're selected and what sort of support is given to them and how they are able to feed back to, but also incorporate comments from the wider parts of the population which they are representing. I'd also like to ask about whether that strategy has been also shared in an easy read version, because with my experience through the Sunlight Centre, there are charities that can help with putting various public documents into easy read, which enables and facilitates much better participation in sort of important documents like this. So those are the two questions I want to ask. Thank you.
In terms of engagement and representation, we, as James says, we have currently got members with learning disability and autistic members on our board, and they represent a wider group of people through the Learning Disability Partnership Board and also through the Transforming Neurodiversity Group. We are seeking to have wider representation and membership on both of those groups. They'll be our experts by experience groups to inform what we do. And so we're looking to have particularly members from Medway to be more represented on that. So that's an active piece of work that we're doing at the moment. We are keen to have as wide a voice as possible informing what we do from people with lived experience. So again, thinking about how we engage with wider citizens through different means. So either face-to-face, through surveys, through easy access routes as well. So thinking along those routes. In terms of easy read documents, the strategy has been written in plain English. It hasn't been converted into an easy read document yet. When we are in the process of having it signed off through KCC, I believe it's been signed off through Medway previously, and then it will go on the public forums, and it will go in an easy read version and in accessible versions.
Yes. Okay. So, sort of, what you're saying is that when it gets to go to the public forums, that's when you'll ensure that it's been developed into an easy read format.
Yes, that's correct. Yeah. Yes.
And if I could ask for a further briefing paper at some point on the actual rollout of getting more experts with lived experience within Medway, which you've highlighted. And also, perhaps, I think it would be beneficial for us to see the easy read version when it has been developed. Thank you.
Very happy to do that.
Thank you. Councillor Griffin.
Thank you, Chairman. I've just looked through my diary, and Tuesday we're supposed to have had a members' brief on diversity, mental health, dementia and autism, and it's been cancelled. So why has it been cancelled? Does anyone know?
James, over to you.
Thank you, Chair. It's been postponed, Councillor Griffin, because of the attendance. There was very low uptake from members, so there was a decision that was taken in order to add value to the meeting and not to have to redo it again, that we would postpone it. So it's not been cancelled, but we're just rescheduling that meeting.
They're going to oh, they are, good. That's fine. Thank you.
So
Thank you
that
very
was
much.
me and you, Sylvia, that signed up for it. So.
Yeah.
Sorry, Councillor Price.
Yeah. In connection with that, I'm sure I speak for Councillor Kemp as well in my role as Group Whip, but we do value the opportunity to know about things such as not having enough people responding, so that we can do our bit to chase people up and bring it to their attention, as it were, from their peer group and not just from Democratic Services, who do an amazing job to try and make sure that these things come to our attention. Thank you.
Thank you, Adam. Councillor Purdy, as there's no other members. Wendy, sorry.
Yeah, thank you, Maria, for coming along and updating us. And James, I think, yeah, it's still got a lot of legs to go, hasn't it? But it's a start, and we all look forward to seeing it and being very successful. And we note the report, and I think, what was it you actually wanted, Councillor Price, put in as a recommendation? I couldn't quite hear you.
Thank you, Vice Chair, Wendy. Yeah, basically the things that I asked for was a written briefing which would illustrate to us what's being done to increase the numbers of experts needed from that care group, as it were, within the Medway area, because that's been highlighted as being short, below what they would wanted. Then the other aspect is to see an example of the easy read version when that has been developed for the public rollout of the strategy, to make sure that it's being understood and that adults with conditions like learning disability are fully given the opportunity to comment and to inform what's being rolled out.
I'm sure Michael's got all that.
Yes,
Yeah,
that's
Councillor
right.
Price.
And then the other recommendation was to make sure that where we are short of members signing up for important workshops like the one highlighted by your colleague Councillor Griffin, that we do involve the group whips in the sterling work which Democratic Services try and do to boost numbers of councillors signing up for these briefing sessions, because it does help sometimes to be able to draw to busy members' attention the need for them to also take up the opportunities to actually participate within briefings. Thank you.
Okay, thank you. I'm sure you got all that, Michael, didn't you?
Yes.
Sorry, Michael would like to respond to that.
Just very quickly, it's a good point. I'll feed that back to Jane Ringham, who of course is in charge of the Member Development Programme. No, thank you.
That takes us on to agenda item 7, the Care Quality Commission Local Authority Assessment Framework, and Jackie Brown will introduce his report. Thank you, Jackie.
Thank you. So I'll just give a brief introduction, and I think the majority of people in the room know that the Health and Care Bill published in July provided new legislation about the CQC being able to carry out assurance reviews of adult social care. So they stopped about 15 years ago. So in the same way that children's services are inspected by Ofsted, that ceased in adult social care. That's now being reintroduced. The assurance reviews start in April 2023, so not too long to go. Although at the moment we still haven't had the the detailed information about what the reviews will look like. We have a good understanding of that because the draft assurance framework has been produced. So the paper touches on section 2.4, the area that the CQC will review and assess, and obviously it will report the assessment on how the local authority adult social care division is performing. It will be assessing part 1 of the Care Act. I've listed in the paper in 2.5 what the Care Act duties include, so that's quite a considerable proportion of the work that is carried out by adult social care. And in the same way that children's services receive feedback, adult social care will in the same judgment, so outstanding, good, requires improvement and inadequate. One of the areas of concern, I suppose, is that it does also include the ability for the Secretary of State to intervene when a local authority is considered as failing to meet its duties, again in the same way as it does for children's social care. So the CQC are introducing a single assessment framework. There are going to be 5 key questions. So is the service safe, effective, caring, responsive and well led? And under each question there are going to be topic areas and quality statements that they will look at to ensure that care is good, and that will link with the regulations. From a planning and preparation perspective, there's a lot of work going on at the moment. There is still more to do. So we've introduced a Health and Social Care Oversight Board. That's chaired by the portfolio holder with the Chief Executive and senior members of CMT in attendance, along with my finance colleagues. We have a Quality Assurance and Performance Information Board in place, looking at both qualitative and quantitative information. And we have introduced, we've recruited a programme manager to support us and make sure we're keeping things on track. We've had an away day with the team managers and our operations managers to look at the self-assessment and, give a view of where we think we are and the key areas of priority for improvement. And the paper lists a number of areas that where we've been working. I think one of the key things to say is we've been buddied up with 2 other councils, so Portsmouth Council and Reading Council, so that we can share and learn from each other and be critical friends, and I think that's really important. There's Table 5 demonstrates some of the risks that there are currently that we've identified, and obviously as we continue through this journey we'll likely pick up some more. And then the legal implications obviously are around our statutory responsibilities, and although at the moment there are no specific financial implications, we understand and recognise that the likelihood is that there will be some financial pressure for us, which obviously we're having conversations with Katie and Dave about in the room. And so just asking the committee to note the content of the report, and any questions I'll be pleased to answer.
Thank you, Jackie. Councillor Murray.
Yeah, thank you, Jackie. And with everything else that's going on, I think you've got quite a long way in the preparations, and I do commend staff for all of that. And in some ways, I don't view this as a unwelcome development. On the contrary, I think it will help focus the minds of the council, and particularly our friends over there in finance, on the demands that the directorate is under, and we've seen what can happen if we're not across the way that our services are held to account, with the difficulties that we've had in children's services, although much good work, obviously, I do acknowledge that, has gone in to change it. So I wonder, Jackie, if you can just give us a feeling of how staff are responding to this, particularly in the context that, I'm very aware that we've got a higher number than we would want to of agency staff, and there continues to be recruitment difficulties. I think, doing the self-assessment probably has been a useful and sort of refreshing exercise to come to the risk assessment. And I just, I'd like to hear how staff are feeling about it.
So we held the self-assessment was carried out with the team managers up, but the away day was the majority of staff were in the room, and if they weren't in the room, they were on Teams. I think at the moment, everyone's recognising that it's happening. They know that it is because we talk about it a lot. But there's an air in the background of it still seems a long way away. So we're having to do quite a lot of work. So, if you think about it realistically, April's 4 months. Now, that doesn't mean that we will have our visit in 4 months' time, but we've got to be prepared as if we were. So working with the principal social worker is working very closely with the team. I think you've met Michelle, and really engaging with them, as are the heads of service and the operations managers. I've started to meet regularly with team managers on my own so that we can, really build that relationship up and get them into a position where they understand what this means for them. We've talked about whether we need to provide training for them specifically around this, but I've spoken to, that's a lie, I didn't speak to, I was at a conference, where the DAS of Manchester City Council, who were a pilot scheme, was talking about their experience, and actually she said that the training them is not a good thing. What you see is the CQC can recognise a mile off when somebody has been trained and staged, and actually it needs to be more natural. So it's more about giving people confidence. So we need to think about that mentoring and coaching, so that when you've got not an inspector, a CQC officer sitting next to you, that you feel comfortable and competent enough really to talk about the cases that you know and you own. And I've mentioned in here we're looking at how we can move to an allocated caseload model, because if we don't do that, then the conversation about, the people you're working is going to be very difficult if you don't know them. So that work started.
Thank you. There are no other members, so Councillor Purdy.
We just note the report, Chairman. But I just think I'd like to say, Jackie, I think it's an excellent job that we're doing. And I think our thanks ought to go to all the staff that have worked very hard towards this. I'm sure everyone will agree with me there. Thank you.
Thank you. Thank you, Jackie. That takes us on to agenda item 8. I would like to welcome Tracy Rouse, the Director of Strategic Change and Population Health, who is here tonight for this item. I'm told this will be your last meeting of this committee. I bet you're very glad of that, as you're about to retire, I'm told. So, Tracy worked at Medway Hospital for a number of years and also at Medway CCG, and has been a really good advocate for the health of the people in Medway. On behalf of the committee, I'd like to thank you for the work you've done in the past. Thank you very much. And with that, you'll be pleased to know it's James that will introduce the report. So.
Thank you, Chair. And again, Tracy, you've been a brilliant colleague to us, working across in the old CCG days and obviously in the new ICB days. And actually, it's been really helpful, members, to have Tracy at the centre of helping to develop the integrated care strategy, because she understands Medway as a place and ultimately the needs and the challenges that we face. She's been able to hopefully ensure that we can move forward in relation to the work within the strategy. And if I might, just going back to an earlier piece, Councillor Murray, you were referencing the data and the information in the pack within the diagnostic piece that we talked about before. All of those profiles, members, are on our council website. We've got a section under our joint strategic needs assessment, and in there you've got all of the profiles, and clearly we link through down to the ward profiles. I'll try and be really succinct, actually, because I think it is to get into the debate around the integrated care strategy. In our last meeting we talked about the production and the timelines, and I just want to really reaffirm this is an interim document, and actually it's only a document. It's the work that we need to do that is more important, and we recognise, and hopefully that is written, that we haven't had as much time as we would want to engage, to go out there and to interface with community members, and it's been a bit of a challenge because of the national timelines that have been placed on us. But the reassurance, members, is that we will, following the completion of this draft phase, it is an interim. We've got a process, not least because we're developing our joint local health and wellbeing strategy for Medway, which is our place-based document, which informs the work that is set out in the integrated care strategies. So this work, as we've done now, we've come to a place which is to submit a document for the end of December, but we will actually be moving forward with our own local consultation to further inform the final strategy, which will be completed over the next 6 months. You've been given the document. I think it's probably about a debate. I would just reflect on one point, if I might, before handing over to Tracy. Back in the very distant past, when the NHS was one system, we used to have these things called health improvement plans. Members, anyone that was around in this system, I see Councillor MacDonald and Councillor Murray aware of those. And what those health improvement plans were was a system-wide piece that had an NHS bit, so you had all the clinical bits, but actually they were dovetailed into the wider determinants and the broader issues that were about the place. What we moved back to, in my opinion, is that model. So the integrated care strategies are focused on tackling not just the clinical aspects of care, but the way in which we've got to move upstream and deal with a wider determinants, which is why I'm quite pleased as the Director of Public Health that that's the starting point. So just that reassurance, I think that it is a broader document. It is not just about clinical pathways, but it does take those into account, and it should actually give us the ability within Medway to have our voice heard, because that's what it's about. It takes your local issues and throws them into that national piece. So over to you, Tracy. David, if you want to add anything further to it.
Just really to emphasise the fact that this is the first step in a journey. We will be undertaking quite a substantial amount of engagement in the new year, both taking various forms so we can get the views of various different groups on the strategy. And then there will be further guidance published in June of 2023. And then our plan is to bring back a revised version of the strategy probably around about the autumn time.
Okay, thank you very much.
I just wanted stay on. I just wanted to add something around the actual the approach that we've taken. So we know that this was DHSC, NHS England generated with very short notice, which is why we're sat here today and the document came late. But it is the first time we've worked together as a system to pull a document together on this scale. And it was our intention when we set out as a group to start the narrative that this wasn't health-led, that this was very much a prevention-led strategy, and certainly not concentrating on health, but 80% on the detriments of health and 20% on the clinical care. And I'm really hoping that that's come across in the document.
Thank you very much. If I can start then, on page 23 and 24, or 17, 18, depending quite what you're looking at, there is some about, well, looked after children, etc., but there doesn't seem to be anything on children leaving care, going on to live by themselves, etc. So should that area be looked at and maybe some added to this report? Because it arrived late, I can't claim to have read every word, so if it is somewhere else, just tell me. But
thanks, Chair. So one of the key principles here, members, is it is meant to take a life course approach, and the issues around children and young people are really quite important for us to consider. Director of People, Leanne Farrack, who sends her apologies tonight, has fed into the development of the strategy. She's identified quite clearly some of the challenges that you put in to us, and what we need to do now is to make sure in our process moving forward from the interim phase that those issues are picked up and built into the final strategy, if you will. So it's a really good point, but just for reassurance, members, that Director of People has identified those issues, particularly around children, and the need to make sure that the final strategy is robust and does take into account those particular issues.
okay, thank you, James. Councillor Murray.
Yeah, I mean, the document did come very late, which was regrettable, but one of the things that I'm most interested in is the focus on health inequality, because they're so persistent. We saw through the pandemic that the people who were most impacted were all the people that we already know who suffer health inequality. And worryingly, every time we look at a particular pattern of disease or an issue that we've got, we see that Medway, falls down. We've got this group of younger people suffering with chronic and long-term conditions at a much earlier age than other areas. We've got persistent pockets of health inequality in equally persistent pockets of deprivation. And I wonder, as a group of professionals, what's your confidence about the way all the good and laudable things in this strategy will actually change the health inequalities and level up the life chances of those people?
Great challenge, Councillor Murray. So I'm going to give two particular perspectives. So one is, this is our opportunity as a system. Members have got, you've heard me speak about this before. You're the people who are out on the streets taking consultation with your particular electorates who are telling you, and you're seeing that and you're advocating for their needs. What we have to do is to make sure that we move from this thing just being a piece of paper, which is why it is, and you've heard Tracy's ambition, and she's very clear about that, that the process that we use to then set out our action plans really do pick up on those particular nuances. Tracy mentioned the 20% of the issues that lead into people unfortunately becoming ill are only amenable 20% to healthcare and health and quality of healthcare. 40% is about education, skills, housing, those wider determinants, and that's the kind of narrative that we're trying to weave into delivering against, the ambitions. This is a longer term ambition for us, but I can say from the meetings that I've been in, and I'm sure that Tracy will perhaps triangulate this, and perhaps David as well, our focus has been on how can we narrow that gap. What is it that we need to do for those people whose voices haven't been heard? I reflect on the conversation, and thank you for picking it up, in relation to the LD health check argument, because they're the people whose voice doesn't get heard. They're the ones who potentially are not able to access some of the care and support that is there for the general population. So it's those kind of issues that we need to move forward with. There has to be a reckoning, and David will be able to sort of cement this. There was guidance that was put out last week, new refresh guidance, that the whole system, and including the integrated care strategy and the board, need to take account of local factors that have been identified through the joint strategic needs assessment and the joint local health and wellbeing strategy. And that also includes the requirement to take account of how resources are allocated to meet those needs. So it's a long sort of response to you, but I'm trying to just reassure you, your voice will be heard, our voice at place level. The issues that have been identified in the strategy, the moved away, and that's what Tracy was upfront with that, from it's just about the clinical stuff. They are trying to move upstream and deal with some of those wider issues that we know need more time to address, and I think that's the commitment that's been given. We're at a symposium on the 28th of October, and everyone in that meeting pledged to deal with these broader issues and not just focus on those narrow bandings around the clinical care, as important, and they are important as they are. I don't know, I want to throw to perhaps David and Tracy to maybe fill in some of the gaps. Thank you for that. Hung me out to dry. No.
Has got their mic. Okay,
Yes.
Come back now. Yep. One of the extraordinary things that we've heard as part of our work in the GP task group is that 85% of appointments are socially determined, as opposed to actually really being clinically determined. And we did see an example of some really good joint working across services when we went to visit St Mary's Island practice, where they had actually had a big focus on a group of people who keep coming round the track, who are in very poor condition and suffer things like poor housing, poverty, mental health problems, addiction problems. And, you know, their view was that they were extremely open to working with people like, you know, our housing department, the DWP, you know, anybody who could help change the social determinant of people's medical conditions. And just reading the strategy overall, whilst it continually promotes the idea of integration, I don't at the moment think that it addresses and makes possible the kind of partnership working and joint resourcing that it's really going to take to shift some of the things that I've mentioned already. Their particular work has been focused on Chatham Central, and they'd had project and pilot money for the particular group of people that were recruited to the boot surgery when it opened. And they saw in a pilot phase some good results, but of course the money disappeared at the end of the pilot phase, and the good work is in danger of diminishing as well because the money isn't there. And you know, there's nothing worse than that, is there, to have a pilot that really shows an effective impact with potential for sustainability, and then you find, oh, we haven't got the money for it and we have to stop doing it, and those people sink back down again. And I think, you know, that isn't the only example I could name of good work that's been done that then has, you know, sort of faded away at the end of the pilot and at the end of the reporting. So, you know, I think that the willingness amongst practitioners who want to change the lives of people in these inequality and deprivation groups is there, but their sort of financial power to make the difference that they would like to doesn't at the moment exist in any form that they feel could make a real difference. So, you know, that's the kind of, if you like, more granular type of work that I would like to see falling out of that strategy.
Thank you. James?
Thanks, Chair. Councillor Murray, again, you've really hit the nail with a massive hammer, and I think all of us, and I personally would definitely recognise that we have got to empower those colleagues who are out there on the front line with the right, that we've got to give them the support that they need to make that difference. And the points that you made around the GP Access Group, non-communicable diseases, we know the prevalence high, and when you'll read my annual report when it comes through the committee this year, it's on hypertension. There's a spoiler alert. You'll see how I've tried to nuance the challenges around some of our more challenged communities. So I think I've got a couple of examples that might just give you a bit more assurance. So first I'm going to go to Tracy's example when she was Director of Primary Care across Medway. I'll embarrass her. She invested a significant amount of resources into social prescribing as part of the work that we were doing around identifying people who needed a bit more support. We can see from the work that we've built on with all that initial investment has shown to be very beneficial for some of our communities, and actually it's changed the way in which people think. And I know through the GP Access work you've identified the benefits of that kind of work, so that's enduring. One of the practical things that's happening at system level is that the funding, that the ICB gets a significant amount of resource for inequalities funding, and albeit that you've got 3.2 billion that goes into the whole system, we really need to look at how we align that. But there is specific funding that is identified for the system, and off the top of my head it's about £5.9 million in that range. And what they're doing this year is they're devolving 80% of that resource into the health and care partnerships, and that process means that they at a local level will be able to identify the things that they believe will make a difference. So the issues that you've raised there and flagged around how do we resource and sustain those kind of initiatives, how the local providers, organisations working together get together and able to do that. So that's going to be managed through the health and care partnership at Medway Swale. And Nikki Teasdale, had she been here tonight, I'm pretty sure would be able to back up those comments that I'm making to say they're now able to do things like that, independent of what's happening at a national level. And then the final point is just, we all must recognise, and I definitely do, that we've got to be evidence-based in the way in which we deliver any intervention. We've got to make sure that it reaches and does whatever it is that it's meant to do, but delivers a proper outcome for our population. I'm minded that, obviously, it was announced in Parliament, so this is no surprise really, that they're looking at a review of how the integrated care boards work to try to do some of the stuff that you're talking about now, which is to make them more efficient in the short term, and there's meant to be a report back, and I think it's Patricia Hewitt that's doing that work before the end of December. That's not going to derail what we're doing here, because this is what we're talking about is working at place. But I'm pretty sure as part of that process, they will look at how they're allocating resources to deliver the outcomes that are making a proper difference in tackling inequality. So hopefully that's given you some reassurance. We've got a local fit, so the money that centrally is being devolved across Kent and Medway into the local systems, the majority of that for them to take the lead and to control that. There are local plans, and you'll see within the documents that, you know, Dr. W and his team have been at the forefront of working with colleagues, obviously in KCC, to make sure that we identify the right things that need to be done to tackle the inequalities that you described.
Tracy, you wanted to
Thank you. I just wanted to build on the inequalities funding and one of the points that you made earlier around areas of deprivation. The ICP, the Inequalities Board, made the decision that we would allocate that money based on the deprivation scores. So it's not a population-weighted devolvement of that finance now. It's actually done on a calculation that scores on deprivation. So obviously Medway will do better out of the funding going forward, and we also took that approach for the capital funding for the clinical, for the community diagnostic centres as well. And I think that we're going to take that approach a lot more going forward in terms of your point around levelling up and making some of this money work where it's actually needed.
Okay.
Thank you. Councillor Price.
Yes, just to follow up on the inequality or the like equality aspect, I noticed in the actual report, which is attached, that under and it is a draft report, I do realise that, but under section 3 it refers to the Equality Act 2010. That's on page 71 of the agenda item 8, which we've had, and it says that under the Equality Act 2010, the ICB is required to meet its public sector equality duty. Does this impact assessment demonstrate that this policy, function or service meets this duty as per the questions below? And no response or lack of evidence will result in the assessment not being signed off. And then it includes the table, but there's nothing, it's just blank in terms of the evidence for the need to eliminate discrimination, harassment and victimisation. It's blank underneath 13, advance equality of opportunity between people who share a protected characteristic and those who do not. And it's blank under 14, foster good relations between people who share a protected characteristic and those who do not. And so I just wondered, because it's a draft, does that mean that that part of the report hasn't been completed yet? Thank you.
So the process is iterative as we go through the development of the strategy, and when it's finally agreed and published, the IAOB will be completed through the governance processes and reshared. So no, it's not complete yet, but it will be.
And again, like the earlier item which I asked for, if we could have, as I'm sure we probably will, but the further version which includes the missing bits tabled as a briefing note. Thank you.
Okay. Thank you. As there are no other members, Councillor Purdy, and if you can add Adam's suggestion for the recommendations.
To repeat them, because I don't always pick them up, Adam.
Hello there. Yes, okay. I'm going to sit much closer to the... I hope this reverberates now. Thank you. Yes, it's just that on page 71 of the agenda item 8, which came round late, which actually refers to this item and the aspect which my colleague Councillor Theresa Murray mentioned earlier on about trying to show how we are reducing the inequalities in health. There is a table there under Section 3 under the Equality Act 2010 which does not yet include any evidence of how the ICB is meeting its public sector equality duty. So we've just heard from the officer that this is an early draft and that's going to be addressed later on. So I'm asking that we have the fuller report when that element of the work is complete to come round to us as a further briefing note. Thank you.
Okay, thank you. Tracy, you wanted to come.
Yeah, just for the notes, it's not the ICB, it's the ICP, and it's the three organisations that it's the equity impact assessment will cover Medway Council, Kent County Council and the ICB. So it's a system document. I wouldn't want it misled that it was just the ICB's document because it's reflective of all three.
Sorry, yes, and
Sorry, just
Michael wanted to come in.
just to try and help. I mean, once, as Tracy said, the document has to be agreed by the three partners. So once that's all been agreed and signed off, we can just circulate the final versions to members for information.
I just move that we note the interim.
Yeah, Councillor Purdy, I think you faded away then. I couldn't hear what you were saying.
This is not good, is it? No. We both shout at each other then.
Right. Thank you. Is that agreed? Right. Thank you. Thank you, Tracy, and well, enjoy your retirement.
Are you retiring, Tracy, or are you moving on to other things?
I'm taking a break for a while, and then I'm looking at doing some voluntary work, either at home or abroad.
That sounds lovely. Good luck.
Thank you again. That takes us on to agenda item 9, the draft capital and revenue budget 2023 to 24. Katie, if you could introduce.
Thank you, Chair. I'll try and keep it a bit briefer than I've previously done, sorry. So the process to develop our draft budget began back in summer when we started to prepare the financial outlook 22-23, and at that stage our initial projections arrived at a potential budget gap for the council in the range of 33 to 56 million broadly. Whilst the financial outlook projections were set out in ranges of figures, for the draft budget we've refined all those assumptions down to our best estimate at the time of publication. However, I should say that the draft budget was considered at Cabinet just a couple of days ahead of the Chancellor's autumn statement, so it's really important when you're reading this report to note that it doesn't reflect the impact of any of those announcements. In short, the draft budget assumes income of about 5 million across council tax, about 5 million across business rates, some uplifting grants, including an estimate of the adult social care reforms funding that had previously been announced of just under 6 million, but some significant increases in cost of services on the budget requirements. So they're shown in the appendices of the report. I suppose the key one for this committee is 12 million on adult social care, including the projected cost of implementing those reforms as we understood them before the Chancellor's announcements. A net 16 million increase on children's social care and education, almost 8 million on the cost of financing our capital programme, 4 million on inflation, a couple of million on utilities and about 5 million on staff pay. And all of that took us to a gap of about 28.7 million. Obviously, officers are working really hard with portfolio holders to try and formulate savings proposals that will address that gap, discussing those options with the leader and cabinet members through that normal budget setting process. Confirmation of our allocations of those government grants will come through the local government settlement, which we're expecting to see on or just in front of the 20th of December, and we'll report to Cabinet and try and project what those announcements will mean for our budget gap. Clearly, the primary focus at the moment is on revenue, but in terms of capital, the report reflects the current capital programme of almost £500 million. As usual, we'll add capital grant allocations as they're announced. And we will be bringing a capital strategy to Cabinet in December. So yeah, this committee is asked to comment on the proposals in the remit of this committee and feed those back to business support overview and scrutiny in January, who will in turn make recommendations on to Cabinet. And if you would like, I can talk a little bit about what the Chancellor's announcements might mean for Medway's budget, or if you just prefer to review that on the Cabinet agenda in January, obviously that's fine. Yeah,
Please.
I can probably keep it under a minute. So key announcements for this committee are probably around social care. So the delay of the adult social care charging reforms for at least 2 years. Although the announcements were silent on the market sustainability and fair cost of care exercise, so it's not really clear whether that will go ahead at this stage. The statement did confirm that the funding that was set aside for that, for those reforms will still be in the sort of sector and would be distributed to local authorities, although the national quantum's slightly lower. We'd assumed 5.8 million of grant and expenditure, and on that, based on some sector briefings, we're assuming about 3.3 million of that was for the charging reform, so we might be fairly safe to assume that we wouldn't need to spend that, but the other bit we're less clear on. There was also 1 billion of new funding in the system for 23-24, rising to 1.7 billion the year after, of which 40% we're expecting to come to local authorities. So that could be about 1.6 million for Medway for next year. The rest of that national quantum being routed through the Better Care Fund, so yet to be determined how we split that with health. Other bits of good news for this committee, I suppose, Household Support Fund continues for the full financial year, an extra 2.3 billion in that. Anyone who's interested in businesses, business rates, multiplier frozen, the retail hospitality and leisure relief increasing from 50 to 75%, other good news for business. Some transitional relief for the revaluation, which is also good news, and all of that stuff being funded for local authorities. Benefits and state pension increasing in line with inflation, national living wage, increase to £10.42 an hour for those over 23, and the rent cap set at 7%. They're probably the key announcements for Medway Council, but obviously happy to take questions on any of it if we're able to, Chair.
Thank you very much. Councillor Murray.
Hello again, Katie, because we had, I think, our third fairly, and this one probably won't be as long, but, you know, appreciate the way that with limited information you try to make sure that we're as across what has been a sort of moving target as much as possible. So for the rest of the committee, Chair, when we were at Children's, we had a discussion that was about the fact that there's a slightly improved position resulting from the budget. And I asked Katie, and Katie kindly agreed to look at this. Since the Chancellor has chosen to sort of elongate the time frame for some of the reforms and activities that we were expecting to have to do, including charging, for which obviously the Council has recruited a project manager, and that work has been going on. What I was saying is, you know, would it not be possible to give the directorates space to make the investments and the changes that they need to sort of show a kind of a range over a longer period of time of the budget settings, so that the gap becomes a kind of dynamic gap that says, if we're going to make this investment further down the track, these efficiencies will happen, rather than trying to have a kind of sort of squeeze view of the efficiencies, so that it gives staff space to actually do the new things that you want to do, that you hope will turn a more efficient result, without always being under such pressure within the same budgeting period to make the efficiencies. And Katie said she would very kindly have a look at representing the budget with that sort of range. So, you know, that what I said at Children's Services about that applies to this committee as well. Just to try to, represent it a bit differently. Whether the Cabinet will like it or not, of course, is in the lap. But it seems to me to be a sensible way of trying to show that the investments that we've made, and there's been obviously significant investments in children, and there has been some investment in adults, and there could be more, particularly in terms of trying to manage the market by, for example, setting up our own facilities. So I was hoping that, in the fullness of time, in a couple of months, that really means, doesn't it? We might see something like that. And we had, I thought, Katie, a tacit agreement that that was something that you would try.
Thank you, Chair, if I may. So when we're setting a budget for a specific year, we have to land on a set of numbers because full council is required by law to set a budget that balances. But what we absolutely talked about and what we will do is, in terms of making forward year projections, we've always attempted to do exactly that and land at a position where we were forecasting our very best estimate of everything that we need to spend and everything that we think will get in. But from alongside the budget that we present to Cabinet in February, we're working on a set of much broader assumptions which are based on principles, so an estimated number of placements at an estimated average weekly cost, or an estimated number of staff at an estimated rate of increase in pay over the next 5 years, for instance. And that what we would like to try and do is set those out in terms of ranges and be quite explicit about what the underlying assumptions are, so that the reader would be able to apply a sort of rationale to that. And so that's what we're working to, and when we would look to be publishing those alongside the budget in February. And the only reason we're doing it in February and didn't do it in the financial outlook is really just because we've had a couple of years of really short-term budget settlements from the government, and so it's sounding like the settlement that we'll be getting just before Christmas might give some indication slightly further out into the medium term, which means we're on a bit of a surer footing to actually publish something. But realistically, Dave's team and I will probably be working to do something along those lines for autumn in future years. Like, we'd see ourselves moving back to the sort of medium-term financial strategy type model, and presenting that stuff in a set of ranges is probably more useful for all parties, really. So that's what we'd be looking to do, I think.
Thank you very much, Katie. As there are no other members, over to you, Councillor Purdy.
Thank you, Katie, and thank you for trying to keep it short. It was just that I think we were all very cold on Tuesday evening, weren't we? So, anyway, and thank you for the work that you're doing, because it's not an easy task. Whatever way would be damned, wouldn't we? Yes, I recommendation, I move that we note the Cabinet has instructed officers to continue work with the portfolio holders in formulating robust proposals to balance the budget of 223 to 224. And forward the comments on the draft capital and revenue budget to Business Support Overview and Scrutiny Committee.
Okay. Thank you very much. Is that agreed? Thank you. And that takes us on to agenda item 10, the Council Plan Performance Monitoring Report and Strategic Risk Summary Q2 22-23. And James will introduce this report. So over to you, James.
Thank you, Chair and members. The report clearly is in your pack, members. I think we've got two areas of red performance. I think it's probably just helpful to focus on those areas, and Jackie will give us just a quick overview as to where we are with those.
Lovely, thanks, James. So the two areas that are red are the usual suspects, the percentage of long-term packages that are placements, and the proportion of adults with a primary support reason of learning disability support who live in their own home or with their family. And we have, so if I talk about the long-term packages of care briefly, we have seen a deterioration in that trend, and the number of people moving into permanent residential care has increased. I actually asked for some analysis to be done on that, because we know that there are some challenges with the market, and it didn't sort of make sense that we were seeing an increase if there weren't the beds available. So, that demonstrated that in the first 2 quarters of the year, we had 74 new clients that moved into residential and nursing care. And we did some analysis, and 52 of those clients actually were discharged from hospital. Now, when we've looked into that a bit further, actually, some of those didn't end up staying as permanent placements, so we expect that we will see a reduction coming through in the next quarter. However, we do also know that where we were having those significant problems with home care capacity and not being able to provide care in people's houses, there were alternatives that we had to look at and place people in residential care rather than within home care. Now, those reviews have taken place, and where people have been able to move out and back home, because I'm really pleased to say that we're in a much better position. As of last week, there were only 4 people waiting for home care in Medway, which is a really, really massive improvement. So I'd like to think that we will see that number coming down. My caveat is that we are seeing people with more complex needs and people that need care. It's the last resort. We don't put people into care homes. Families don't want to do that. So, it'll be interesting to see how that progresses. And then with regard to the number of adults that have a primary support reason of a learning disability, this is something that we struggle with quite a lot. Now, we know that some of it is to do with recording, and I have spoken about that previously when I've been here. And so we've got a focus group at the moment being led by one of our team managers around what do we do and how do we make sure things are recorded properly. But the other area we know is that because we were not on top of our annual reviews, which is when we do find information out about people, where they're living and so on and so forth, obviously that would have had an impact as well because we weren't keeping up to date with things. Now, again, we've done a specific targeted piece of work, and as of today, and I'm going to kick myself because I can't remember the number, but we've had a significant improvement in the number of annual reviews that have been carried out. We've been around the 30% mark, and I think we're at about 40 something. We've seen so we should see that change as well. So hopefully over the next, the next couple of quarters, we'll see an improvement.
Can I say only 4 people in or waiting home care is, yes, very, very good. Thank you to, you and your team. But, yeah, thank you. Councillor Purdy?
I think it's excellent, Jackie, that there's only 4 people, but can you tell me how long they have been waiting?
These are their new referrals.
Oh, they're new.
So we've actually got rid. The team have done a phenomenal job at working with the system. So we've worked with the hospital, we've worked with the ICB to say actually these are the providers that we use, these are the rates of pay that we pay, and actually you can't go and use people that aren't on our framework, that haven't been quality assured. And doing that has meant that we've been able to provide the care, and so the 4 are they're new. And we very rarely see handbacks, so we were seeing a lot of care packages being handed back to us. We do get the odd 1 or 2, but that's generally because of behaviour and the relationship between the family and the care provider sometimes doesn't work well. I have to say hats off to James's commissioning team and my brokerage team. They've just done an amazing job, considering our colleagues in their neighbouring authority is still at about the 380 mark for people waiting for care. So it's a real difference.
No, well done to everybody. Thank you, Jackie, and thank you.
Thank you. I think the committee would, yes, like to send our thanks and perhaps a letter signed by either the parties or all members, or if we can sort that out of this meeting. But yeah, well done. Thank you.
Absolutely, Chair, I agree with that. And I think, Jackie, there's a tribute to it's good to have the commissioning teams, and there's been like a kind of tacit acceptance that we've moved to almost a preferred provider model, haven't we? Which makes sense when the market's hot. But I think as well, given the kind of churn of staff and the number of temporary staff that you're managing, notwithstanding the actual outcome, It is a tribute to the way that people, even if they're working in an agency, from an agency, feel quite well supported by you and by other managers. And I've had some direct experience of that, where a care package in my ward did go wrong, but the duty social worker who at the time that she was helping me was an agency worker and hadn't been in Medway very long, but nevertheless, she took the actions that I wanted her to take in a really timely way and kept me up to date with what was going on and kept the family up to date with what was going on. You know, it was a very frail older couple, and it really was a good piece of work, managed over the phone when I was in fact away, by somebody who was completely new to Medway, but had sufficient confidence that her actions would be supported. So that is, a good thing.
Sorry, I absolutely know who the family are, so thank you, and I will pass that on. I just did want to add something else, because I think it's really important. So not only have the team worked really hard, but in the midst of the crisis, when actually we had people with no support, there's OTs, some of our social workers and some of our frontline staff actually pulled together, and they went out and delivered care. So for the people that were not, were at risk and that we could not provide care for, they were going out the evenings and weekends and actually delivering that direct care themselves. That's how much pride they have in their job and value their job and to support people. I don't get the chance to sort of show off much around that, but I think that's a really important thing to talk about.
Thank you. There are no other members. Councillor Purdy.
You have every right to show off, Jackie. I would be. In fact, I think I will do, because I think this is good for us to pass on to the public how well we're doing in Medway. So we'll all be showing off. Anyway, I forgot what I'm doing now. I move that we note the Q2 2022 to 2023 performance and amend the statistic risk summary. Note the clarification. Have I got the right recommend? Yes, I have, haven't I?
Yes.
Note the clarification of risk as live or managed as set out in section 2.7 and 2.8.
Thank you. Is that agreed?
And I can't even blame it on...
No. Thank you. Thank you. That takes us on to agenda item 11, the work programme. Over to Michael.
Okay, thanks, Chairman. Keep this fairly brief. So there's a number of changes proposed to the work programme in the report, which I'm happy to answer any questions on. Since the report was written, in fact, in the last couple of days, I've been approached by the ICB about another 2 possible items for the next meeting, which will be discussed at the agenda planning meeting. So one is about plans for plans for a Kent and Medway service for elective planned orthopaedic surgery in Maidstone, offering surgical treatment to patients from across Kent and Medway. And the second one is about a proposal to improve places of safety as part of transforming the mental health emergency and urgent care pathway. And as I say, these have just emerged quite recently, so they can be discussed at agenda planning.
Councillor MacDonald.
Thank you, Chair. I know on the, the 2 extra items are fine, but I know on here we've got South East Coast Ambulance Service and the hospital coming at the next meeting. I think it's really vital that, especially the ambulance service, do come to that meeting. I just wanted to put that plea out there, and for them not to try and delay or to move that forward. And James, I suppose it's a cheeky part that I can ask a quick question to you about plans or emergency plans in place with regards to the possible ambulance strikes that are coming our way, and how involved you are on that. Is that okay, Chair, just to put that one out there?
Yep, of course. James.
So as you would expect, the bit about contingency, so a couple of weeks ago we were down at the Canterbury cricket ground doing a whole exercise around winter resilience, including, of course, some of the challenges that you've described around ambulances. The ICB, one of the ministers, I think it was Lord Macomb, came down to look at the Operational Control Centre down there, just to look at some of the issues that are being identified. So I can assure you, I mean, Tracy's gone now, that this is a serious issue. It is being looked at because of the points that you made around resilience, and I, like yourself, heard the issues about people waiting and whatever else in terms of ambulances. So the ICB are on top of that particular challenge, and I'm pretty sure when the ambulance colleagues do come into the space, they'll be able to give you some feedback as to how they're actually operating. I myself and Jackie are on call often at the weekends, working in that space, listening, hearing. They do work to divert ambulances from point X to point Y. The on-call director within the system, so the NHS on-call director, is very proactive in terms of identifying any challenges like that, and the ambulance service are always on the call, feeding back what the blockages are, what they need to do to address it, and everyone sort of wraps around them. So that's the only assurance I can give you. I know you obviously try to link into what we might then do about contingencies around nurses and stuff. That's out of my direct control, unfortunately, but I'm pretty sure that they will be planning and working through that.
Thank you. Was there, Adam, did you want to? No? Yeah.
That's right. It is to do with the work programme, if I may. It's just to ask, I was approached by the health branch of Unison at Medway Hospital about a proposal to transfer Harvey ward, which is for physically frail elderly, over to the Isle of Sheppey, and we've heard about other services being set up on Sheppey, etc. I know that Michael has done his best through his contacts at the Trust to be able to find out more about this, and a briefing paper was circulated which was talking about more beds being identified over on Sheppey to allow Swale patients to go to Sheppey rather than come to Medway, and that this will enable more Medway patients to receive a service. But the contact that Michael had didn't mention anything about Harvey ward, which was the whole point about the contact, because whenever there is a proposed change to move a ward, it should be coming before this committee for us to be able to identify whether it's a substantial variation, just like we've heard earlier on with other items. So I didn't know whether Michael had any update on that, or whether it's best left for a future meeting of your work programme people, sort of when Democratic Services have got more information back from the Trust. Thank you.
We do have MFT, I believe, at the January meeting, so we'll be able to ask them then if it's not forthcoming before. Sorry, Dan?
Thank you, Chair. It was just coming back and thanking James for his response. I think my comment mainly is that with more, it's more than just the striking action with the ambulance. There's a lot of other questions that this committee needs to ask. And I'm just a little bit concerned because we are coming to the end of our cycle of meetings. There are some really important items on that January meeting with Medway Maritime, the ambulance service, and of course the GP Access Task Group, is to make sure that all of them still get a decent time so we can question and we can comment on what we need to do, so we're not just either pushing or shoving people off the agenda. I know we don't normally, Michael, but I'm just saying that is a really important list we've got coming in January, and I think we need to concentrate on that more than trying to slip others in if we can help it.
Did you want to come?
Sorry, just very quickly. Decided not to work. Oh no, sorry, it's back on. Sorry. Just in terms of Councillor Price's response, I did ask for clarification on that specific point about Harvey ward, and I haven't had a response yet on that, but I will come back and chase that. And in terms of the work programme, Councillor MacDonald's quite right. There's a lot of important things on that agenda. So it's just a question of probably very little that can be moved, I suspect. So there's just some work to do in terms of getting more detail about these two new items that have emerged and the timescales, and try and plan things as best we can at agenda planning.
My thoughts are, myself and Councillor Purdy recently had a visit to the hospital, talked to the chief exec, etc. I've also been in touch about the elderly and frail for personal reasons. And I do believe some of the wards are changing the way they are working, but they are not disappearing. And one ward may now have a, well, say the elderly and frail, they might be moved from one ward to a different ward, and the original ward used for an assessment unit, for instance. But I don't believe that they're closing any of the wards or doing any less of a service, but that's just my view. And if that's all of the comments, I think over to Councillor Purdy.
Thank you, Chair. I just move that we approve the proposed work programme as set out in Appendix 1.
Is that agreed? Right, thank you. Thank you.
I've just got one question for James. Has the new provider for substance misuse been appointed?
I think that should be outside because we've finished the meeting, but that's fine. Carry on, because we all have an interest. Please, James.
We are going through that process, Councillor Murray. We're nearly there, but we can't make that announcement as yet in and open.
And I know there's plenty more meetings, but this is the last HASC before Christmas, so happy Christmas, everyone. Thank you.